All right, welcome to The Explainer. Today we are tackling a super common and, let's be honest, super annoying condition that a lot of us have dealt with, especially in the summer, swimmer's ear. So let's dive right in and figure out what's really going on.
You know the feeling, right? You've had an amazing day at the pool or maybe the beach, and then a day or two later, bam! Your ear starts to ache, it's got that deep itch, it feels kind of full, and it's just so uncomfortable.
And yeah, you're not wrong. Everyone calls it swimmer's ear. But today, we're going to go beyond the nickname. We are going to dig into the official clinical practice guideline to see what it really is, how doctors diagnose it, and, most importantly, how to actually manage it the right way.
So, first things first, what exactly are we dealing with here? What is swimmer's ear from a purely medical point of view?
Well, in the medical world, they call it acute otitis externa, or just AOE for short. And if you break it down, it makes perfect sense. Otitis means inflammation of the ear, and externa means the external or outer part. So it's pretty much just an infection of the skin that lines your outer ear canal.
Now, this is where it gets interesting when you look at what's actually causing it. As you can see, the huge majority of cases are bacterial. That's why the usual treatments go after bacteria first. Fungal infections, way less common. And get this, sometimes a fungal infection can actually pop up after you've been treated with antibiotic drops. Wild, right? You can even have a mix of both.
Okay, so how can you be sure it's actually AOE and not something else? Well, the official guidelines make it surprisingly simple to figure out. It basically boils down to this two-part diagnosis. First, the symptoms have to show up fast. We're talking within about 48 hours. That's that classic trio of pain, itching, or that plugged-up feeling of fullness. Second, and this is an and, not an or, there have to be physical signs of inflammation. So it's a combo of how it feels to you and what a simple physical test shows.
And this brings us to the absolute key test. This is the big one. If you gently pull on your outer ear, the pinna, or you press on that little cartilage flap in the front, the tragus, and it hurts, that is a classic textbook sign of acute otitis externa.
This is probably one of the biggest points of confusion, right? Is it an outer ear infection or a middle ear infection? Well, with a middle ear infection, that's otitis media, doing that same pull test usually doesn't cause any pain. That pain feels much deeper inside, and it often shows up after you've had a cold or some other respiratory thing.
Okay, let's walk through a scenario. You think you got swimmer's ear, so you head down to the pharmacy. What's going to happen? Well, they're going to do a little bit of detective work.
They'll start by asking a bunch of questions to get the full story. When did it start? Have you been in the water recently? And this one's really important. How do you clean your ears? Because using things like cotton buds can create tiny little scratches in there that are basically an open invitation for bacteria. All these little details really help them lock in the diagnosis.
So after that little chat, they're probably going to want to take a look. They'll likely use something called an otoscope to peek inside your ear canal. They're just checking for that redness and swelling we talked about, and also making sure your eardrum looks okay.
Okay, I need you to listen up because this next part is incredibly important. While most cases of swimmer's ear are pretty straightforward, there are some serious red flags that mean you need to stop what you're doing and see a doctor right away.
So take a really good look at this slide. If you have swelling or tenderness behind your ear, not just in it, or you start getting systemic symptoms like a fever or feeling really weak, that could mean the infection is spreading. Also, if your ear canal is swollen completely shut, or if you have other health conditions like diabetes, you've got to get a doctor's opinion. These are not things you want to try and manage on your own.
All right, so let's say we're in the clear. No red flags. Now we can talk about the good stuff. How to get you feeling better, and, just as important, how to stop this from ever happening again.
So the game plan is pretty clear-cut. Here's what you absolutely should do. Manage that pain with some over-the-counter pain relievers, and do your best to keep your ears dry. Now for what you should not do. Oral antibiotics are not the go-to for simple cases. Topical drops are what you need. And please, I'm begging you, step away from the cotton buds. They just push gunk further in and can easily damage the super delicate skin in your ear canal. And here's some good news. Once you start the right treatment, usually medicated ear drops, you should start feeling some relief within about 2 to 3 days. But if you're not feeling better by then, or if things are getting worse, that's your cue. Time to see a doctor.
And look, to stop this from becoming your recurring summer nightmare, prevention is everything. It really just comes down to 3 simple steps. 1, keep your ears dry.
2, once the infection is totally gone, think about using some over-the-counter drying drops after you swim. And 3, just be nice to your ears. No scratching, no poking with random objects.
So, after all of that, what's the one thing you should really remember if your ear starts to hurt? It's that one simple test we talked about. Does it hurt when you gently pull on it? That little action right there is often your clearest clue about what's really going on inside. Thanks for tuning in.